With the election behind us, much of the attention of official Washington has turned toward the approaching fiscal cliff.
But for many state governments, the big issue is an earlier priority for President Obama, his health care reform, and how to implement it.
24-hour News 8 political reporter Rick Albin joins us with how the state of Michigan is dealing with that process.
Time to play catch-up. Michigan, like a lot of Republican-governed states, had been waiting to see what the U.S. Supreme Court would say, then waiting for the outcome of the election. Neither offered the relief from the Affordable Care Act they had hoped for, but by then the looming deadlines for making some key decisions were upon those states that had been dragging their feet. Still, even as Friday approached what was supposed to be the deadline for deciding how to set up a marketplace for insurance providers, that so-called exchange, there was really no particular urgency in Lansing, and that may be because most observers expected and states ultimately received a time extension. So instead of having to figure out what to do with the exchanges by last Friday, the legislature and governor now have until the middle of next month. If they don't have it by then, could there be another extension? Well, there have already been a number of variances granted on the way to setting up this new health care plan. Partially because of the reluctance of some of the states to go along with the idea, and partially because no entity, not even the federal government, seems to know exactly what these exchanges will look like, even if they themselves, the feds, are running them. Michigan lawmakers will now decide if they want to run the exchange as a state by themselves. Some Republican leaders appear to be leaning that way. Or do they want to be part of a partnership with the federal government, or do they want Washington to do the whole thing? With the legislature possibly in session for as many as 3 or 4 weeks in the lame duck session, it would appear they'll have plenty of time to approve the plan. That is, if they can reach a consensus. Brian?